Attention! If you or a loved one has been diagnosed with lung cancer, then you may have already been exposed to the expensive, harsh, and inconvenient treatments such as chemotherapy and radiation. Side effects from such treatments include, but are not limited to, fatigue, flu-like symptoms, hair loss, or even emotional and memory changes. Thanks to technology and research, a new therapeutic treatment for lung cancer will be available soon for lung cancer patients. We were lucky enough to sit down and talk to one of the researchers from the University of Kentucky to learn more about this new dry powder inhaler.
My name is Samantha Nedick, and I'm a postdoc researcher both in the Chemical Engineering Department and the Department of Pharmaceutical Sciences. I started back in August doing the aerosol nanoparticles. I did something kind of similar. I did a postdoc at Ohio State last year, and so I had a little bit of background in it. But I've been doing research a long time. I've been doing cancer research almost 6 years now. Known anybody who's gone through any sort of cancer therapy is that it is still barbaric and it is still harsh and difficult. The side effects are significant, and even if you can say you're going through radiation and chemotherapy, even if you can make it through that, you will still have side effects forever. I mean, therapy not only is the goal to help save lives, but eventually, a lot of people like to talk about cancer as a cure, but eventually what you want it to be is a chronic disease. Like, you may never be able to get rid of it, but you can continue to treat it and have a high quality of life while you're doing so. Dry powder aerosol nanoparticle microparticles, and these contain paclitaxel, which is a chemotherapeutic. And so instead of having, when you have lung cancer, instead of having a drug systemically delivered like chemo, you would just have like an inhaler, and you would be able to breathe in this dry powder, and it would deliver the chemotherapy directly to your lungs where the tumor is, so you'd have less side effects. And everything we're using is already FDA approved. The phospholipid that we use is actually used in infants or preemies because their lungs aren't developed, so it helps their lungs develop better when you deliver this surfactant to the lungs. Normal inhalers, they're like prepackaged and everything together, and so what would be cool about the aerosol is that instead of having to come in and get chemotherapy once a week or every 2 or 3 weeks, you could actually take the treatment home with you. So not only would it have less side effects, but it'd also be more convenient. I guess the hypothesis would be that by using inhalable nanoparticles containing a chemotherapeutic, you're going to get enhanced efficacy as compared to systemic delivery, while also decreasing side effects. You'll get sustained release because of the excipient that you're delivering it in, so that you can get an overall enhanced therapeutic effect. If everything were to go right and we get into animal studies in the fall and finish it by December, just goes to show you some timeline, we wouldn't be able to even start writing a proposal to start a clinical trial until the spring, and that takes about a year to get approval. So it would be at least 2 years from now before we even be able to start a clinical trial.
Lung cancer treatment has its serious side effects and can be extremely costly, both financially and emotionally. The dry powder inhaler introduced by Dr. Samantha Nedick will provide lung cancer patients with affordable treatments and a better overall experience.